Shining bright, sunshine in the sky. Megan and Tammy here to testify, spreading love, laughter and good vibes too. The Fat Girl Chronicles, we're breaking through. No more.
Hey, this is Tammy,
And I'm Megan,
and together we are the
Fat Girl Flippers. And today on Fat Girl Chronicles, we are going to talk about health. But first, before we do that, just make sure you comment and like our video. Make sure you hit that subscribe button on the YouTube. And if you don't like to look at our faces, we also do audio podcasts on all the different podcast apps that you can imagine, including Apple Podcasts, Spotify, all the good stuff. So feel free to listen to us on there. And today you might notice it's not just the two of us. We have invited a lovely guest on today. Go ahead and introduce yourself.
Hi, my name is Suzanne. I live in Halifax. I'm a social worker. Me and Megan were chatting about that beforehand. And I'm fat, and I love chatting with other fat people about fat stuff. So when I heard you guys were looking for someone to chat, I was like, oh, that sounds like something I would be interested in doing.
Yeah.
So here I am.
I love it. I love it. Yes, social workers unite. It was so funny. Like, we were just having a conversation before this, and just listening to you talk, I'm like, yes, social workers. Just like they have that essence, like social structures,
For
sure.
sure.
The way that the world works. It's just so like, yeah. I love being around social workers. They're my jam.
Yeah, me too, for sure.
So yeah, we're gonna talk about health today.
Yeah.
So I know that we've talked a lot on the podcast about like my PCOS journey and also my hyperplasia journey, a lot of like fertility stuff. Tammy's also talked a lot about stuff like that. Like health it's one of those things that is so important, and not a lot of people give much thought to, just going to the doctor and getting help if you're, I guess, I don't know what we want to call it, straight size. If you're not fat, your health experience might look really different than what it looks like to us. Yeah. So did you want to like talk about...
Yeah, sure.
Yeah.
We were saying beforehand how this is such a big topic, like talking about health. So it's something that for me, I think has been the hardest thing to kind of navigate or like work through in kind of what I call, I guess, like my fat liberation journey, right? Of just kind of like unpacking and unlearning all of the stuff that I had internalized about being fat and what that means, and how people are treated and how I treated myself, right? And I heard you guys talk about one of your podcasts about that kind of internalization, right? That it's about, oftentimes we just put the blame, like I'm fat and that's bad, and it's because I'm doing something bad or I'm lacking something, and this is all about me. And I came to this kind of point where I just started learning a lot more about it and started to be like, whoa, this is like not it's about me, obviously, but it's about so much more than that. Like the bigger kind of systemic issues. And that's what we were talking about. Social work is, as a social worker, we learn about systemic racism, ableism, homophobia, transphobia, all these systems of oppression. And we don't really talk about anti-fatness. It's still this very individual, like, oh, but that's your fault. And it's like, you're not trying hard enough. And the narrative is that you just have to try harder to be thin. Like, that's always the goal, right? Like, you have to end up thin. And the reality is, like, some people are fat for a number of different reasons, right?
Yeah, absolutely.
Whether it's, like, environment or genetics or lifestyle factors, like, whatever it is, people live in fat bodies and always have, and they still deserve care and compassion and destigmatizing healthcare. So it's simple when you break it down like that, but it's so complicated still.
For sure.
Yeah.
I mean, I think that internalization piece is so important because especially, if you really are internalizing the fat phobia towards yourself and blaming yourself, to even advocate for yourself in the medical field.
Absolutely.
Like, it's so hard. I can remember when I first started going to the IWK and everything, they wanted to put me in for, I think it was an MRI, something like that. And so, you know, I was really nervous, but I was going to go in, and I did it. And I was literally at the appointment. She called me in at my time that I was supposed to go in, and she said, are we able to weigh you again? And I was like, okay. Turns out I was like 2 pounds. Even though they have my medical records, I was 2 pounds over the weight limit for this machine. So they couldn't do it.
Right.
I had waited, I took the day off work.
That's wild.
I had gone in. I mean, they have access to my records. They would have known.
Yeah.
But then when you're sitting there and you're blaming yourself and you're embarrassed and you're
100%.
like everything else, what can
And
you
that's
do?
how the system kind of leaves people feeling that way. It's like, oh, you're 2 pounds over. Like, oh, like it's your fault. It's like, oh, what about like the machines that you built? You know, like, and I get that like you can't build a machine overnight, but I'm just saying that's like an example of how weight stigma is baked into our medical system. Is that they have these limits that are based on like the preferred way that they want people to look or how people should be. And when you're not that, then it's like, oh. And there's also such a big narrative about how we want fat people to care about their health. Like, you guys, you need to care about your health more. Like, you need to care about your health. Fat people don't care about their health. But then you go to access healthcare and they're like, oh, you're too big for this. And it's like, well, like, what
is it?
Yeah. Which one is it, right? So yeah.
And it's, you know, we've talked a lot about on the podcast around like shame, like, you know, shame is not going to work and not going to help anyone lose weight if that's what they're
It never
desire
has.
is. Yeah.
We'd
like,
all be thin if that was the case. Like, we don't,
exactly.
like, you know,
exactly. Forget all the diet fads. I mean,
for sure.
we wouldn't need them because we'd just be so shamed into being something different. Hello.
We have another guest.
So cute. Do you want me to get him off or you got it?
Oh. Oh. He just likes to be part of the conversation.
There we go. But yeah, no, I definitely think that's super, super, super important to remember is that, you know, kind of like the gym thing too. People are like, well, just go work out at the gym. But when you go to the gym, you're afraid of getting stairs, or if you, God forbid, you ask for help, or that you're sweating a little too much, or whatever. It's the same thing with, you know, going to the doctor. Like,
do you remember, like, a few years ago, there was, like, they made this, like, Nike apparel for, like, plus size, and there was, like, a plus size mannequin, and then the outrage that was, like, how dare you make fat clothes for fat people to go to the gym? It's like, isn't that what you're telling us to do? Like, it's just
because you care for our health, and I'm putting that in
the math
quotations.
doesn't math, you know. It's just like what? So it's, and again, it just really comes down to like anti-fat bias and weight stigma and how pervasive it is everywhere, and it's just very easy to blame fat people instead of blaming these other things that have created like where we are right now. So it's a lot to unpack.
It is a lot to unpack, and I feel for, you know, anyone. I'm really lucky to have the family doctor that I have. My family doctor is fantastic.
That's awesome.
She's like not weight focused at all.
Amazing.
Really
Wow.
good. Yeah,
Okay.
really good.
Yeah.
And so I'm very lucky to have that because I know not everyone else has that.
Yeah.
You know,
And
like,
in this province, as we know, it's like lucky to have a family doctor, period.
Yeah.
Like, you know, like so many people don't have a family doctor, and then to have one that's like not focused on weight is amazing. And there is something I was thinking about talking about here too about that is like I have a family doctor, so I feel lucky that I have that. And she's okay, like she's definitely not weight neutral, I would say. Like
Okay,
she's
yeah.
you know, she's like, oh, losing weight would help, you know, whatever. I'm like, cool. I've never thought about that. I've never ever thought about that my whole life. Thanks.
You have shocked me with your news.
Yeah, right, yeah. But she's someone that I go to and she's nice, whatever. One thing that I've really, the past few years and kind of unlearning all this stuff is trying to do is like get other sources of weight neutral care where I can. And I say that in a place of like privilege and acknowledging that like I have access to some of it, but there's not even much. Like I live in Halifax, which is a city, but even there's not tons. But like, for example, I have a massage therapist who is like one of her like areas of focus is fat people. Like she's like fat positive massage therapist. And I had never gone to a massage therapist before because I just didn't feel comfortable going to a massage therapist that was likely going to be this like thin person. And I didn't know what they thought about my like mostly naked body on a table and probably most of them are lovely. Like, you're right. But it's
Right.
like, it was this thing that I was like, that seems really unsafe to me. So one day I literally just Googled like fat positive massage therapist in Halifax,
That is such a... I
not
would
thinking
never
I'd find
think.
anything. And she came up, and part of her was like a fat affirming. And I've been seeing her ever since. And it's just been nice, even to like have that social connection of someone who is like-minded. And it felt safe to me because it's like she identified as fat people often don't feel safe going to a regular massage therapist, right? So she's creating that environment that kind of removes that. So that, and I also found, you guys have talked about therapy a lot on this podcast,
Yes.
and I found a fat positive therapist. She's actually not even in the province. It's like a virtual thing, but she's lovely and she's fat and is fat positive. So when I talk to her about all this stuff,
So
like
cool.
she just gets what I'm talking about, and I don't have to like explain it to her. So I've really been trying to like find those things when I can, that it's like, okay, even though the healthcare system, when I deal with it, is usually pretty fat phobic, like trying to find other professionals that are fat positive or at least weight neutral. And I did find a naturopath in Halifax actually, who's also very wonderful and weight neutral. And that's been really good, just to have someone that I can kind of like talk to about and kind of like
Yeah.
get ideas, or maybe you can ask your doctor this or whatever. So, and I understand that not everyone has access to that, right? But
Right.
if there's certain people or organizations or whatever, and even if it's just fat community, like you guys are creating
Yeah.
this platform for
Yeah.
people to kind of talk about, like anything that you can kind of reach out to find people who are like-minded, just kind of helpful, right?
I never even thought about Googling professions
Yeah.
that are fat positive.
Yeah,
That is
and
such a good
Yeah,
idea.
and there's not many, like I will
Yeah,
say,
yeah.
especially in Nova Scotia. But I just was like, what? And I was really surprised, honestly, that one came up. I think since then there's like another massage therapist in Halifax who also is like fat.
That is so cool.
Yeah, isn't it? Yeah, it's super
That is
cool.
so cool. Like I've had a couple of massages,
Mm-hmm.
and they've not been bad experiences, but it does.
Yeah,
It is a little anxiety
Sure.
inducing.
For me, it was just like I didn't know. And again, this is the only massage therapist I've seen because I just was not feeling comfortable before. But I just
Yeah.
didn't know. And again, they probably are mostly lovely, but I didn't want to feel like I'm in this place where like this thin person is like touching my fat body and being grossed out the whole time. And maybe they would not, but that was just something that I couldn't get past. So to have someone who's like, I'm providing this space for people who generally feel that way.
That is so cool.
Yeah, it's super badass, I think.
That is
She's
so
super cool.
cool.
Yeah. So doing that, and honestly, I'm currently working part-time on my master's of social work, and a big like motivation, I guess, or inspiration for me to do that has been kind of like learning about anti-fat bias and all that stuff, because I've been seeing this therapist for a couple years now who that's kind of like her focus.
Yeah.
And I found so much like support and help, and like it's really been beneficial to me. So I was like, maybe I can like be that person. And I
Yeah.
don't know that that's what I'll end up doing with it, honestly, but it just kind of, it's another way for me to kind of like get out all my like, stuff about anti-fat bias and like
Yes.
fat phobia that I want to like talk about, I guess.
Yeah,
or like
that makes sense.
bring forward. Yeah.
So are you doing something like that, like for your... Do you have to do a thesis for your master's? Or
I
you post it?
don't. There's two routes. I'm going to be doing a placement, but I
okay.
am trying to just like bring it in wherever I can.
Yeah.
Because one thing too is social work is like about systemic oppression, right? Like I mentioned earlier, we talk about all these systems, but in my education, in my workplace, I have not heard about anti-fat bias or fat
Yeah.
phobia. Like it's
Yeah.
not one that we talk about. So I've been trying to like shove it in there.
That's
I can.
great.
So I recently just finished a paper on Friday, actually, that I was specifically talking about the intersection of being fat and transgender. There's a lot of
Okay.
kind of overlap in those identities sometimes of how they're treated or how we talk about them. And so, for instance, one of the things that I talked about in that paper is like access to gender affirming care.
Yes.
Like there was articles before about like
Yes.
people, oh, your BMI is too high. You can't even get a consult if you want, like, I think someone was searching a couple years ago for like a mastectomy. And it's like, you can't even get a consult before your BMI is under this. And they were like,
Really?
what? But you don't know anything about my health other than this like one marker. And there's so much research out there that talks about how there's not more risk generally to do it on higher BMIs, we just don't want to, I guess.
Yeah.
Right?
Yeah. Oh, that's so interesting.
Yeah. So it's just like, it's one of those things too, and I'm sure you guys see it, like once you kind of start thinking about like fat phobia or whatever, you just like see it everywhere. Like it's just, it's all over the place.
I was lucky, like they've not, like in social work, they've not talked anything about like fat bodies or fat phobia or anything like that.
Yeah.
But I graduated with gender studies at MUN, and they
I'm doing my MSW through MUN.
Oh,
That's so
really?
funny.
Okay, well, there you go.
Yeah, okay.
Oh,
interesting. So they talked about it there.
They talked about it within the program, yeah. I even had to read a book. One of their course requirements, it was called Fat, ! So.
I've heard that. I haven't read it, but that's cool.
Oh, okay.
That's amazing.
I'll bring that to you sometime because I'm pretty sure I still have it if you want it.
I love that was part of the curriculum. That's the first time I've heard of anything like that, so I love that.
There's a whole fat studies, like in
yes.
there's like,
yes.
So that's kind of what really woke me up.
Wow.
Yeah,
for sure. Oh, that's so cool. That's good to know. I guess that's like
a thing
there somewhere.
Yeah, because it should be in. I mean, there's lots of things that should have been in the social work program. Yeah. They've missed a lot of different areas, but that would be an interesting one.
Yeah. That's so cool. That's really good to know. So in the meantime, I've kind of been just like throwing in like, anti-fat bias stuff when I can. And I was gonna say I like it in the sense of like, I guess that it's something that I'm passionate about, but then I also feel like I'm the only one like talking about it here. Is like anyone else know about this or like, and not to like, because I didn't know about, I didn't kind of learn about like kind of anti-fat bias as like a systemic thing or just for the last few years really, right? So I get that, but it's just unfortunate that it's not more, we don't talk about it more. It's not more recognized as an actual form of bias, not just like being mean to fat people. And being mean to fat people is bad and is also a form of bias, but it's like so much bigger than that when we talk about MRI machines that don't have, or like blood pressure cuffs, right? Like I've been to a doctor before where they don't have a big enough cuff, and it's like, what? Like, what do you mean? Isn't this like, I don't get it.
Exactly. The blood pressure cuffs.
Yeah. And then if you have a one that's too small, then you're more likely to get a higher reading.
Mm-hmm. It's more painful, and you're feeling more shame if it breaks off before it's supposed to, and it's brutal.
Yeah, no, it's totally wild. Yeah.
I will say the Truro Hospital, so I ended up having to get my test done at the Truro Hospital. Mm-hmm. They're a newer hospital, and they have the equipment for fat bodies.
Yeah, that's great.
Yeah, so I did end up getting it there.
Yeah.
But,
it shouldn't be like a thing that you're like, wow, that one hospital has, it's nice that they do, but it shouldn't be like a big, like, wow, that's amazing. It should just be standard of care, but that's not.
Especially when you're talking about, like, with the original one at the IWK, I mean, you're talking about women who, are getting ready for pregnancy and,
all types of people get pregnant. Yeah. Like, and have different body types. Like, that's just where we live, right?
Yeah.
So, so much to unpack there.
There is, yeah.
Yeah.
Tammy, what do you think about health? Fat bodies and health?
Just that there's a lot of stigma still attached around it, and especially BMI, like we were talking about earlier, that BMI is a big one.
Yeah.
No pun intended.
But, I didn't even catch that.
Yeah. And not being able to access care because of your BMI is a big one.
Yeah. And BMI, I guess we mentioned earlier, is something that I've like learned about, I guess, is like, and there's like a whole history. I'm sure someone could explain it better, but my understanding of it and what I've read is like, first of all, it was built in like, I think like the 1800s by like some random guy who just wanted to like measure the population and find like the average man. Yeah. So it was this measure that was like a statistical exercise used with primarily like European white men, or I think all white men. And it was never intended to be a health measure, like ever.
Right.
And then there's a whole history with like insurance companies started using it, and I don't know all the intricacies of that, but it is kind of, that happened. And then it got adopted by the medical system, and it just has stayed kind of ever since. But it's also like in the 90s, I think, they like lowered the cutoffs. Yeah. Like, and not because they thought it was like beneficial. I think it was just like, I think some of the things I read were like, oh, like the numbers are easier to remember. And now I feel like I'm just going to go down like a rabbit hole of things.
So
but anyway, so they lowered the number. So at that point, there was all these like, you know, like CNN and all these like articles were like millions of people woke up fat to work yesterday, right? Like, so, and then you have these spikes and like these graphs that are like, people are just way fatter than they used to be. And it's part of that is true. Like we have gotten fatter. We've also gotten taller. Like a lot of things have changed about humans over the years for a number of reasons, right? So the BMI is still used, which is wild because it never was supposed to be like a health measure, and it's used to kind of screen people out of a lot of things, and the medical system also often recognizes that it's not good. It's like, oh, we get that it's not really good, but like this is what we have, and it's like, I think we could probably find something else or nothing at all, or just scrap it all together.
The interesting thing about the BMI too is, so I one of the things that I have a certificate in disability management. Okay. And so part of the course was you had to do, it was like this little flyer that you'd put into the workplace about different conditions, and one of the conditions that she offered up was obesity. So I took a spin on that, and because I was figuring that she'd want me to make it like really anti-fat, you know, but I kind of did a spin off. And I talked with the BMI, and one of the things about BMI too is that it's literally your weight and your height, but your weight is also made up of like muscle and fat. So that chart has no idea, cannot literally not talk about any sort of divide. Like someone who is super in the gym, athletic, you know, I'm going to put in quotes, healthy, might have a lot of muscle.
Could be classified as,
their BMI might be off the charts.
No, exactly. And one thing too that I wanted to touch on, I guess, is the like whole obesity narrative. And that's one that I tried to like stay away from, in the sense of like, it's really like medicalizes, I guess, fat people, even if they don't have medical issues. And speaking of BMI, back to that, there's also just like a long history of obesity being classified as a disease. And there's like interesting, like sketchy things that happened around that. Like, and I'll just touch brief, but the American Medical Association, like in, I think it was like 2013, I know this because I recently like put this stuff in my paper that I submitted last week. So they decided, they put a team together that they appointed. So they appointed their team, American Medical Association, being like, here's the committee that's going to look into if we should classify obesity as a chronic disease. The committee comes back and is like, no, like we don't really think it should be. It's hard to define. There's all these like causation links between obesity and things, but we can't say that, or correlation, but not, we can't prove like that it's a cause. There's so many other things. So like we don't think it should be classified as a disease. And the American Medical Association was like, okay, but we're still gonna do it, basically. Like, so that's how it became, right? We don't know that story. Gosh, all we know is like obesity is a disease. And that hasn't really helped lower the stigma either. It's not like people are nice to people who have diseases.
No,
right?
exactly.
Like, so there's all this like background too of like where we got, and this is kind of where it starts to sound a bit like conspiracy theory-ish, but it's true.
I love it.
There's also like a lot of like pharmaceutical companies who have a lot invested in having a new disease, or we hear about the Ozempic stuff happening now. Right? Like how popular is it to like have, right? So there's a lot to gain from anti-fatness. There's a lot to gain from fat phobia and having obesity as a chronic disease.
Yeah, you're right. You're absolutely right. And the thing about, so Ozempic frustrates me. So I am on Ozempic for PC. Well, actually, I shouldn't say that. So I had to go on Ozempic because this is another thing. What the hell? So my fertility clinic will not give me, they'll give me one sort of treatment at any BMI. I have to be under 40 BMI to get any other treatment. So IVF, all of it, I have to be under 40. Right. I'm not there, obviously. Right. So to fast track that, she put me on Ozempic. My family doctor has not brought it up to me. Like my family doctor was really hesitant to put me on it.
Interesting.
So she only did it because she trusts the Like
Okay.
she'd be like the fertility or gynecologist or whatever.
Yeah,
she is.
yeah.
But she wants to fast track weight loss so that way I can receive treatments. Interesting, eh?
Yeah.
Mm-hmm.
It just makes me like cringy. And I get, and people do what they have to do, right?
Yeah.
Like I'm not saying like
Yeah.
like you're whatever. Like people have bodily autonomy, and people have to do what they can to like survive in this like anti-fat system.
Yeah.
And
Yeah.
then people are
But not covered under insurance.
right,
So then you're talking $300 a month,
right,
$250 to $300
right,
a month for
right,
medication.
right. Who,
That I don't
so
necessarily
many
even
people,
want.
right, and so many people are on right now.
Yeah.
From the people who actually need it for diabetes management to
Yep.
people who are like celebrities, who are like, I want to lose 10 pounds. And I'm like,
You can afford it, right? So again,
Yeah.
if you're gonna say obesity
yeah,
is a disease and needs to be medically treated, well then my insurance company should
Right.
have no issue
sure, yeah,
covering it.
yeah, exactly, right,
But because I'm a fat person who has last appointment was perfect blood pressure, I'm not diabetic.
right.
I've got none of the
So
I've got no high cholesterol, none of it.
Right.
Like I'm literally none of it.
So, yeah, and not that I actually know this, but I was thinking like, if obesity wasn't a disease, then you probably would be able to access that.
Yeah.
Because they're not saying there's anything medically wrong with you, other
Yeah.
than, I guess, saying you have the disease of obesity that
Yeah.
is not showing up anywhere else
Yeah.
other than you live in a bigger body.
Yeah. And they still won't cover it.
Right? It's just like, once you really start, I kind of think about it as like pulling a thread, right? Like once you start pulling a thread and it's like you're like, whoa,
Yeah.
this is really messed up.
Mm-hmm. It is.
It gets me fired up, and I think that's why it's like the whole kind of systemic part of it is like really what I find interesting and infuriating, and something that needs to be like brought up more
Yeah.
and understood more.
People just and much like the social work, like when going through social work and working at social issues and stuff like that, like there's so many things that just general people are not aware of. And I mean, it's in
100%.
place for a reason. Like
Yeah.
it's
Yeah.
in place for a reason.
Yeah.
So yeah, a lot of people do go to the doctor and experience. I mean, I cannot tell you how many times I've heard such sad stories about women with PCOS and going to their
Yeah.
doctors, wanting fertility
100%.
treatments. I'm blessed that at least they're going to try something with me.
Yeah.
Which is sad to say, but
I know. Yeah.
others have been totally shamed and denied
Yeah.
any sort of.
Yeah. Yeah.
And all bodies have babies. Like,
Yeah,
I mean,
literally,
think
yeah.
about
Yeah.
way back in the day. Like,
Yeah. Yeah. There was no like Ozempic or
Yeah,
like BMI even.
yeah.
Yeah. Yeah. I know, it's wild. And one thing that this is a bit like kind of straying to another kind of place, I guess, but you mentioned about like in over time and how like there's always like fat bodies, right? And that's another thing we hear about is like fatness is like a new thing. And like I mentioned earlier, like we are gotten fatter, we've gotten taller,
Yeah.
we've got, sure, things evolve, but I don't know if you guys have heard of like the Venus of Willendorf. It's
No.
like you maybe have like seen it. It's like a really small like statue that apparently was found in like 30,000 years ago. It's like one of the oldest like representations of art that we have, and it's a fat woman. It's this like and it's very like old, so but it has like big breasts and a big belly and big bum.
I'm picturing it in my
Yeah,
head.
it's used a lot in like fat liberation spaces, but it's just kind of to say like, and there's a lot of similar ones that aren't as old but are still like thousands of years old, and it's used a lot to be like, fat people have always been here. Like it's not
Always.
a new thing, and body diversity is like a natural way that people live in the world, right? Like so that's another thing I think that the narrative often gets kind of like fatness is like a new problem.
Yeah,
and
it's like the obesity epidemic.
yeah, that's
like,
that kind of language, right?
Yeah.
And we accept that diversity like exists in so many different ways, but for body types we don't, I guess, for some reason. Like
I know.
yeah, it's hard for us to like imagine.
It is so weird.
Yeah.
It is so weird.
Yeah.
Yeah.
I feel like it's something you could just like talk about forever, but it's just like it's very interesting. And
Yeah, the medical. What do you think, Tammy?
About?
Anything.
I mean,
You've been doing a lot of listening.
Yes.
That's around.
well, because I've been through the ringer with the
Yep.
being refused medical care because of the BMI, and I have a disease that causes lipomas in my body, which are going to weigh make me weigh more.
Sure, yeah.
But there's no taking into account for that so you're just kind of classed as obese, and that's it.
That's
and they
it,
just
yeah.
leave you alone and
Yeah.
expect you to,
Yeah.
kind of suffer. And it's unfair because I think people of all bodies should have the same access to healthcare.
100%.
Yeah.
Yeah, for sure. And if health is really what we're like aiming for, then like that should be accessible to everyone, right? And when you talk about there, like kind of that intersection of like having a disability or disease or whatever and being fat, it's just like amplified, right? Like similar with having any other marginalized identity and being fat, like it's just then you experience it double fold or whatever, right?
Yeah, and it's almost like it doesn't matter what you do. Like you said, if you try to go to get help with anything, it's, again, there's bias against, you may not fit on the machine, or like going to the gym, for example, or trainers don't want to work with you because you're too large, or there's just it seems like every which way you go to try to correct what they say is a problem, there's no way to correct the problem because we don't have a system in place to create a solution.
Right. I think it's because we've so narrowly
The
focused.
focus is all on the problem.
Yeah.
There's no focus ever been really done on solutions.
Right. Yeah. Yeah. Or the problem at like a bigger level, right? Like, oh, maybe like the system that we've created is not like working for everyone, right? Like, yeah.
Yeah, it's like trying to fit into a box instead of like expanding the box.
Right. Yeah.
Instead of renovating all of the hospitals to have all the proper equipment.
Yeah.
Well, yeah,
the
like
solution is that you need to lose weight.
even like a surgery table is so narrow that the average person would not fit properly on it.
Yeah.
But when you're talking about someone with a bigger body, then they start talking, oh, well, we don't have a bariatric table. Well, when they say a bariatric table, when you look at it, it's
like,
just a regular.
Yeah, regular
It
table.
looks like a stretcher, like a regular size thing that you would put an average person on.
Yeah.
Yeah.
But the actual operating room tables are so small.
Yeah.
So, like, who designed that and why?
Right. And the fact that it's like, oh, we don't have that. It's like, okay, that sounds like a you problem. I guess that you should try and sort out. Like, it's just seems wild to me, especially in this obesity narrative. It's a health condition that we need to treat. Like, but like you don't even have equipment for these people to like come in your space. So
yeah.
And I'm like Megan. I mean, I don't have high blood pressure. I don't have diabetes. I don't have any of these risks that I don't have high cholesterol.
Yeah.
Any of those things that, they would generally assume that a person in a bigger body would have.
Right.
Yeah.
But yet you're still denied the care
Right.
because your BMI is high.
Right. No, exactly. Yeah, absolutely.
Makes no sense.
None.
Like actually no sense.
Yeah.
Really
No,
and truly.
100%. Yeah.
Yeah. And you like with the disability and the weight thing too, that's also a huge I don't know what to call it, but it just specifically, like, we've talked a lot about wheelchair usage, like to have a disability that you need a wheelchair as a person in a fat body.
Yeah.
There's so much stigma that goes around in that.
Yeah.
Like to have to like wheel around. I know, like when we went to Walmart or whatever, and you have to get in those I don't know, like scooters, I guess.
Right.
Yeah. Like people tend to look at someone who
As
is
lazy.
much thinner.
Right. Yeah. Right.
Yeah. You're gonna look at someone thinner versus someone who's fat.
Totally. Yeah.
In different ways.
Yeah. 100%. Yeah.
Yeah.
Yeah. If a slim woman gets on the scooter and uses it, someone's going to assume, she must have knee problems, or like something like that.
Yeah.
And if a fat person gets on it, they're not going to assume that person might have a mobility issue. They're just going to assume she's fat and
Oh, they're
lazy.
fat. Yeah. And that's why she needs it.
And that's why she needs that.
Yeah. Yeah.
Or if she does have a mobility issue, it's because
of her.
It's because
She's
you're
fat.
fat.
Yeah.
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 Yeah. It's all exhausting to think about. Like, it's just like,
it's like a rotating wheel. You're like the hamster on the wheel, and you never get off.
Yeah. Right. Yeah.
Yeah. And a lot of things, I think, tend to make you more depressed, have more anxiety about even going to deal with anything you have medically wrong with you, because
Right.
you're going to be faced with the stigma
Yeah.
of, oh, your BMI's too high, or you're too fat, or you're too this or that, like.
Yeah. That's something too. I don't know if you guys know Aubrey Gordon. Shout out to Aubrey Gordon. Not that she watches this because she's super famous. But anyway, maybe she does. Sorry. Actually, hey, Aubrey. So she has a podcast called The Maintenance Phase. You guys need to listen to it if you haven't. It's amazing.
I feel like my placement supervisor talked about
Okay.
her daughter listens to it. I'm pretty
It's
sure.
really good. Put it on your list, The Maintenance Phase.
Yeah.
So her and one of her friends talk about, and she's a fat woman, queer from the US. She's written 2 books too. One of them is called What We Don't Talk About When We Talk About Fat. And the other one is You Just Need to Lose Weight and 19 Other Myths About Fat People.
Yeah.
So they're really amazing books and very well researched. But her and her friend have a podcast where they just talk about like debunk this kind of stuff, like fat phobia, anti-fatness, living in a anti-fat world as a fat person.
Yeah.
And I feel like I had a point that I was going to link to what you were saying, and now I totally lost it. I got really excited about Aubrey Gordon. But yeah,
So the
plug for her.
maintenance-
The maintenance phase.
Maintenance phase.
Yeah.
I'm
Yeah.
99.9% sure that I've heard of
It's
her
really
before.
good, yeah. And they're funny, and they bring a lot of humor, but also like really well researched stuff about and that's where I've learned a lot of stuff, honestly.
Yeah.
Is from them. But yeah, maybe it'll come back to me what
Yeah.
I
Yeah.
thought that I had
Yeah.
lost.
Yeah.
Yeah.
Yeah, I just think that even when you think about things like, I've never been in an ambulance, but I can imagine that, like, being in a fat body, having to, like, being put on a stretcher and to go into an ambulance, I can imagine how stressful that would be. Just because I think
It was.
I bet.
Oh,
yeah.
yeah.
I had
you've
it happen.
experienced.
Yeah.
It was.
And you're in a place where you're so vulnerable, right?
Yep,
like in that
literally,
place.
yeah.
Yeah.
Yep.
Did you want to talk about that experience at all?
Just that when they came, they were very reluctant to take me to the hospital, and I was extremely sick. And they were kind of, I'd say, more hedging towards the "you'll be okay, just stay here." Of course, they didn't say
Right.
that, but
That was the vibe you got, yeah.
yeah. And then it was like, oh well, we're gonna have to get a couple more people, even though I was like able to get myself up on the stretcher and stuff. But it's like, I don't know. I just feel like there's so much that in every aspect of life, but especially in the healthcare system, that just does not work for fat bodies.
No.
And then, being left on a stretcher, and just, I feel like lack of care in general for people with fat bodies, and you're looked at as almost like an inconvenience to people.
Right. Yeah.
Or that you created your own problem. Even if you
Absolutely.
didn't. Or
Yeah.
even if
Nail on
you
the
did.
head.
Yeah. Right. Even if you did, then it's kind of like, that's the thing too.
But
It's like,
you still deserve care.
yeah, 100%. Yeah.
Like, if someone goes out and does something dangerous, and they
Right.
know that it's dangerous, and they have an accident, and they come into the emergency room bleeding, no one says to them, oh, that was a stupid thing to do.
Right.
Maybe you shouldn't have done that, and
Right.
gives them a
Yeah.
lecture.
No.
No, they
exactly.
treat them.
Or
Yeah.
denies them.
100%.
Yeah. Or says, no, sorry, we're not doing broken arms today.
We've met our quota.
Yeah.
Gosh.
But I mean, that's the
Yeah,
way it is
that's
when you're fat.
Yeah.
And less likely for them to take your complaints seriously too, because they blame everything on your weight.
Right.
You know, like everything that goes wrong with your body is the first thing they're going to say is, well, if you only could lose some weight.
Right.
Like right now, I'm being forced to have bariatric surgery. I've been on the wait list for bariatric surgery and on this ridiculous, crazy diet for almost a year. And forced to have the bariatric surgery in order to get the other treatment that I need.
Yeah.
So, and there's no guarantees that the bariatric surgery is going to work.
Right.
Which
That's the
is
thing too.
useless.
Yeah.
Because, like, she's been practically starving herself. Like, it's been...
It's so messed up.
It is, but because, again, they don't understand, like, her disability or her illness, whatever you want to call it, like, and that her quote-unquote fatness isn't like isn't regular fat, it's the lipomas. So they can't just come up with, you know, the regular diet that they're giving her.
Right, yeah.
So the surgery itself isn't going to work.
And they've even stated to me that they know that there's a very little chance that the bariatric surgery will take off weight that is not lipedema related. As far as any like lipomas or anything that are under my skin related to the lipedema, weight loss surgery is not going to help for that.
Right.
So
It's wild too that we, like, for surgery, they're very quick to approve bariatric surgery.
Yes.
But if you went and you're like, oh, I need my knee,
Well,
they're like, oh, that's too risky. But you can do bariatric surgery and then we'll do
see,
it.
that's
It's like, what?
That's
You know?
what baffles me is
Right.
how come it's okay to do bariatric surgery but you
Right.
can't operate on my knee?
The risk of, like, any risk, I think, with bariatric surgery is always seen as justified. It's like, well, but being fat is so bad that, like, we'll risk your health for this, but we can't risk it for any, like, it's just, again, that, like, anti-fat bias that's just baked
Yeah,
in.
and I mean, I'm not a doctor, but
Yes, none
like,
of us are, for sure.
Yeah, but
And if
I
any,
Disclaimer.
and if
Any
any
doctor.
doctor would love to come on and talk to us, we are open to that as well.
yeah, but I would assume that the, I guess, risk of being under, I mean, obviously different surgeries have different risks, but the risk of being under, for example, would be the same risk
Yeah.
for any
Either
surgery.
way.
Like you're under
Yeah.
regardless.
Yeah.
Like,
But the issue with the surgery on the joints, which would be like a knee replacement or whatever, is that the surgical equipment itself is not fat friendly, is
Yeah.
what I'm going to say. It's
Right.
made for small people.
Right, yeah.
right, because they basically, they're basically not even in the room. It's like some sort
Oh,
of
right,
robot.
right. Yeah, yeah.
But the cuffs aren't going to fit her knees.
Right. Yeah, which goes back to, yeah, the
And
whole,
again,
like, it's just...
There is surgery available to treat the lipedema, to remove it,
Right.
but here in Canada we don't recognize that. If I lived in Europe, I'd be fixed.
Yes, yeah.
I wouldn't have, well, if I lived in Europe, I wouldn't have advanced to the stage because they recognize the disease and they treat it.
There's someone that I follow online, Jordan Underwood. I
Yes.
think. Do you
Yeah,
follow
yeah.
them? Yeah.
Yeah.
And they are like a trans advocate, fat advocate, and they have lipedema and had talked
Yes.
about their journey, and that was really interesting.
Yeah.
And it's not something I knew tons about, but it's very complicated. And yeah, I'm glad that you follow them because I think they have like a lot of good information about something that's not
Yes.
super
Yeah.
out there. Yeah.
Yeah, she has very similar legs to mine.
Yeah. Yeah.
Yeah.
And I always get her mixed up.
Anna O'Brien
Who
from
goes by
Glitters
Glitter.
and Lasers.
Oh,
Glitter
okay.
and
I think I've heard of
lasers,
them.
yeah.
Okay. Yeah.
Yeah, so she's
There's a
also
few.
really good.
Yeah. Yeah.
Voluptuous Leah, Sam Page.
Yeah.
There's quite a
people.
few now.
Yeah.
People that have lipedema that are out there screaming and shouting.
Yeah.
And here in Canada,
Yeah.
we're really pushing. Lipedema Canada is pushing to have surgery. You know, have the surgeons trained and have it available, because it's right now. Being denied that treatment is costing the healthcare system a
Right.
lot more in the long run.
Right. Than if they just dealt with the problem, like with
Yep.
it firsthand. Yeah.
Yeah.
100%.
And then
yeah.
there's the spin-off of that with being denied all these things and then ending up with mobility issues and in a wheelchair and not being able to work and to do all these things. Then you have mental health issues on top of that because you're
100%. Yeah.
Yeah. sick and tired
Yeah.
of not being able to be fixed.
Yeah. Yeah. No, for sure. And there's a lot of there was a case, again, I know this because I wrote it in my paper like last week, but in this woman from Newfoundland, I think it was in 2018. I think she lived like elsewhere at the time, but she passed away in 2018, and she like partially wrote her own obituary, and part of it was like she said she was a fat woman.
Yes.
She went to doctors for years being like, I'm not feeling well, like, and they were just like, you need to lose weight, you need to lose weight, you need to lose weight, and eventually they found out she had like stage 4 or whatever cancer that was like not treatable. And she was like, if the first time I went to the doctor and this had been investigated, I wouldn't be here. And that's where you see the like blatant, like really devastating like effects of weight stigma.
And
It happens. Yeah,
It
she's not
happens
the only.
every day.
Yeah, yeah,
It happens every day.
yeah.
Well, that's how I discovered I had hyperplasia, which is a pre-cancer condition. So I had complex hyperplasia with atypia. And I basically had super, super, super bad period, like for months on end. And then I just stopped having my periods. I got off like completely.
Yeah.
And that's what initiated my referral to IWK.
Right.
And at first it was kind of looked at like, okay, well maybe we need to like lose some weight. Like there was no other answer than like we just lose weight or whatever.
Right.
And then COVID happened and someone took over for my regular gynecologist. And when I had explained the symptoms, she said, that sounds like more cancerous. So let's get you in for a biopsy.
Wow.
And I was covered in polyps that had cancer in them. That's why. So the only reason I didn't get a diagnosis of cancer was because the cells stayed within the polyps and they didn't go into the lining of my uterus.
Yeah.
But I was covered.
Right.
Like covered.
And if you hadn't seen this other doctor, like it could have just kept going. Yeah.
And then eventually what would happen is they would seep into the walls and I would have cancer in my uterus.
Yeah.
And that's what they say part of the like problem with labeling obesity as a chronic disease is that then everything that a fat person has is linked to that.
Yeah.
Right? It's like, well, oh, you have that disease of obesity, so that's probably what's wrong with you. Right? When it's like
for me, I also had cervical cancer, and the reason I found out I had cervical cancer is because I gave birth, and that's when they discovered it.
Right.
Yeah.
Yeah. Otherwise it wouldn't have.
Otherwise, no.
Yeah. That's wild. Yeah.
That is wild. And I have heard horror stories of like people going in for like headaches and stuff and being like, well, maybe you just need to lose weight, you know, and like stuff that makes literal no sense. Yeah. Like literally no sense.
I had a doctor in Moncton when I lived in Moncton that when I went to see her, it didn't matter what you went for. She immediately went for the blood pressure cuff that did not fit. So you know you're going to get a wrong reading and you're already anxious.
Just make sure the boy couldn't see it.
And anyway, that was her go-to, was grab the blood, and she wouldn't have a large cuff. She never would. And then she would immediately start in with the weight thing. She would never ask you what you were there for. And then I would get so upset I'd start crying and I'd be like, you know, a mess, and I couldn't explain why I was there. And then I wouldn't go back.
Right.
So then that's what happened to me as far as, you know, not getting proper exams and things like that. And I think a lot of people are like that you just get discouraged and you give up.
100%. And they say that actually that when they talk about like sometimes how people in larger bodies sometimes have maybe worse outcomes, and that's not always the case, but sometimes they do. And part of what they say the reason is for that is delaying care, because you're shamed every time you go. Why am I going to go see a doctor if they're just going to tell me the same thing that I've tried a million times, right? And then so there's that, and then but then it comes back on you of like, well, you're not caring for your health enough or doing enough, right? But it's like it's so much more complicated.
Way more complicated than that. I mean, the quality of life, even beyond healthcare, just trying to fit into the world. You know, your quality of life goes down, and when your quality of life goes down,
that affects your health.
That affects your health, your well-being, all of it, right? Like whether that's mental or physical. Yeah,
and I've heard a lot of stories, and even what you guys have shared today, and just about people's experience with the healthcare system, and I feel like I have been like lucky, and I don't really want to use that word because I've had bad experiences, but I haven't also had tons of terrible experiences. But I guess something that I think about sometimes is like when I was 13, I started having panic attacks, and I went to see a child psychiatrist at that time. And one of the first things that was suggested to me is like, why don't you join Weight Watchers? Which now I'm like, you know, but and part of that I think was like, oh, you know, you have anxiety or panic because you're fat, or you're fat because you're having whichever one it was. And I probably was having anxiety from all the like anti-fat bias that I was experiencing and bullying and all that kind of stuff. But the idea that it was again like, you know, you should go, and then that was kind of seen as a measure of success too, I think. So, you know, I was seeing this psychiatrist, but then he was like weighing me every time, which as a teenager, I didn't really think tons of it, but now I'm like, psychiatrist,
you know, like, so messed up,
right? And I was right, and I was prescribed medication. In fairness, so I think they have to do it for dosing, but probably not every time. Like he could have seen that I was like, if I lost 5 or 10 pounds, it wasn't going to be in the grand scheme of things make that much of a big difference. So I think it was, looking back on it, you know, I think it was kind of a measure of like, oh, well, she must be doing better if she's lost like 8 pounds or whatever, right?
Like not that, and it's quite possible that you may have been doing worse.
Right, exactly.
By losing 8
and
pounds.
That's right, and that's the thing is like that we always see people losing weight as a good thing. And that's why one thing that I've changed my view on a lot is like, I mean, just basically commenting on other people's bodies, period.
Yeah.
But when you hear people say like, you've lost weight, you know, you look so great, you've lost weight. And I remember overhearing someone say that to a person who had been off like work for a while. And her response was, I've been so sick. All I've been able to eat is like ice caps from Tim Hortons for like months. And that person said, but you look great. And I remember thinking
oh
like,
my God.
wow. It's
So
just,
you might be dying,
yeah.
but to the general public, as long as you're
But
slim,
you look great.
you look great.
So, and that means that you're doing well, probably. You know,
Yeah.
like, so.
Life is good for you because you're slim now.
Yeah, yeah. Isn't that it's such a like overt.
That's
like,
scary.
yeah.
That's scary.
It is because what I find as a person in a fat body is that we are not supposed to enjoy life, or we're made to feel like we're not supposed to enjoy life.
Yeah. Yeah.
There's so many limitations, like you were speaking of limitations in life, like I think of airplane seats, amusement parks, like just all those things that are allow people to have enjoyment in their life, and then you're made to feel, you know, you might be going on the trip of a lifetime and you've spent the whole time agonizing over, am I going to fit in the seat? Do I need this? Do I need that? You know, are they going to embarrass me?
Yeah. And that's something I feel like with this kind of my unpacking of all of this stuff that I've like learned over my whole life has helped me is the last few years, I guess I've been on like a few trips, not super far, but like still on planes. And I started just like when I board the plane asking for a seatbelt extender, and I don't always need it, but sometimes I do. And I see this as such like a big change and like victory for me in a sense, because I feel like 5 years ago, if I would have gotten on a plane and would not have been able to like put my seatbelt on, I would have been like beside myself, I think, with like, and now to kind of just own that and be like, I might need an extender, and like, and does it have like deep feelings in me? Maybe that I'm like, you know, navigating through, like maybe, but it doesn't cause this like overwhelming, like, oh my God, that's so, you know, it's just kind of, and that I think has come for me from following other fat people online and like trying to be more engaged in fat community, and kind of seeing other people just be like, yep, I'm gonna ask for a seatbelt extender, and
it's kind of
and
like
the world
owning
doesn't
it,
end,
right?
And they're usually like, sure, I'll get you one, or I'll bring you one, and then that's it. And I'm like, okay, you know, but it would have been such a totally different catastrophe story, I think, a few years ago before I kind of unpacked all of that.
Yeah, I think the unpacking of things and learning about things and seeing that there's other people that have that same struggle, like all of that is so important. Yeah. Because you really don't know what you don't know.
Right.
You really don't.
Yeah.
And, you know, with fatness, there is such, it's almost like a moral issue.
100%.
It really is.
Yes.
It's almost like to people, it's a moral issue. And so there's so much shame and guilt that comes with fatness. And if that's all you know, then that's all you know.
Yeah. Oh, for sure.
Like, truthfully.
And that's where the kind of good food, bad food, good fat person, bad fat, you know, like if you're a good fat person, you're usually someone who's like trying to lose weight, or you're engaging in these. So that's where, and just talking about foods in terms of being good, or I'm being bad today because I ate this brownie, and it's like, no, you just ate a brownie, you know, like it's
I know.
you're not bad, you just,
I know.
yeah.
Yeah, because it kind of even like falls into, because I've seen a lot of TikToks of like what a fat person eats in the day, which is great. But 90% of them are usually, it's like extremely portioned, really super healthy type of food. Right. And I just wonder, I mean, that could be their diet, but I also wonder if that's also trying to prove something to the world, like I'm a good fat person. Yeah. I'm still eating healthy. Yeah. Like I don't see a whole lot of people like being like, what I eat in a run of a day, having an ice cream or a chocolate bar. Or like I don't see that a whole lot.
And a lot of it I think is safety, right? Like trying to be safe in an anti-fat world, and if you're performing in this way, people are maybe a bit nicer to you.
Absolutely.
Right? If you're kind of doing the things that are seen as good. So
absolutely. Even in the medical field, right? Like even in the medical field.
Yeah. No, for sure.
Oh, you are losing weight. How are you doing it? If you're doing it, whatever. I mean, the whole thing is people are like, you know, we are going to shame you. We are going to do whatever. We're going to totally kind of put you off in your own little island because we care about your health.
Right. Yeah.
But if you're, that person who's lost weight because all they can have is ice caps for a month.
Right.
How healthy is that?
Right. Right.
But doesn't, because it's not really about health.
Right. Exactly. And that's the thing. It never has been about health, right?
No.
And that's the problem. And that's kind of where it gets kind of like it's packaged more nicely when it's said that we care about health.
Yeah.
Right. It's like nice oppression, I guess. Right. Like it's like a caring. Like we care about you, but also we want you to be. Yeah.
And nice. I like that.
Right? Yeah.
But that's you're not wrong. Like it's just it always comes down to like, and then like we've literally talked about this whole podcast. It's like, okay, you want us to be healthy? Let's access health services.
Yeah, right.
Oh wait, you can't.
Right. Yeah.
Like,
So
it's like you said, round and round and
just
around
the same.
and around.
Yeah,
and around.
and it's exhausting. It's emotionally exhausting. It's physically exhausting.
Yeah.
You know,
for sure. Mm-hmm. There is in like we talked about social workspaces earlier, but there recently was the Nova Scotia Association of Social Workers did a couple of lunch and learns about anti-fat bias, which is the first time I'd ever heard.
That's amazing.
Wow.
And I was super pumped about it. And one person there was actually a student. She was a BSW student. Her name is Brooke Cullycutt, I think.
Okay.
And she did a talk about like fat phobia in eating disorder recovery, eating disorder spaces, right? That's another huge thing.
Yeah.
But part of what she talked about was that Cape Breton University is, I don't know if it's this year or next year, it might be this year, are starting a medical program. So it'll be the second medical program in the province after DAL. Yeah. So she wrote a letter of advocacy to the director, I guess, or the head president, I guess, of Cape Breton University, saying like weight stigma is a big issue. I mean, she said a lot more eloquently than I'll say, but weight stigma is a really big concern, and it's really important at the institutional level that you really like think about the use of the BMI, think about how weight stigma affects blah blah blah. So she wrote this letter and sent it in, and I also caught, and she said to share it and send it in if you want. So I guess I'm just linking it back to, again, like it does start at that institutional level, and it was really cool to see someone local kind of advocating for that. And I think we need to bring that message like higher to like, this is the experience of people interacting with the medical system, and we have a lot of valuable things to say, I think, that
for sure.
that need to be heard if you really care about health.
One thing that I was impressed about, I just recently had to go, because of a urinary incontinence issue, I had to go and have a gynecological exam. And there was a medical student there from DAL. So when the doctor came in, he was asking health history and everything, and she had taken it. So she had told him, Tammy has lipedema. And he said, you mean lymphedema? And she goes, no, lipedema. Anyway, so long story short, the medical student had looked it up on the computer while we were in having the exam and stuff. And it made me feel good that the younger generation that's coming into the medical field took it seriously, looked it up, knew what it was, and pointed out to the surgeon that, or the gynecologist that kind of like, you're wrong, or
right.
that this is an actual disorder. And and I think too, for me, like just growing up, and probably everyone, like doctors were just like the be all end all. Like if a doctor told you, this is what you have to do, this is what's wrong with you, you're like, oh, they know everything. And I'm not saying that doctors aren't smart. Like tons of doctors know a lot of stuff and are very helpful, but they also don't know everything, and they have a lot of bias, just like we all do. And they may not know anything about
certain things. Yeah.
They may not know anything about having to deal with fat bodies.
100%, yeah. Because they don't really learn about it much in school, right? So again, and I think you guys have talked about how you advocate a lot for your health, and the naturopath that I'm seeing had said that to me. She was like, you're the only one that's going to really advocate for yourself. Like it's only you, like so you need to advocate for what you need, and it's isolating probably sometimes, right? But like, it's like, because people aren't aware of a lot of things, or they don't know everything, and sometimes you just need, that's exhausting. But
at that same exam, I had to have my blood pressure taken, and now the lipedema is in my arms, so I get a weird reading if they put it on the upper part of my arm because it's different sizes. I'm showing my arm if you're listening and not. But anyway, so what they suggest if you have lipedema is to take the blood pressure in the lower part of your arm.
Yeah.
So I told that to the nurse, and she was like, no, just like, no, right? And I said, okay. But then, anyway, she ended up doing it on the arm, but then she made a big deal of with the doctor. She's like, well, she says she needs to have her blood pressure taken on her lower arm.
Right.
You know, like almost shaming me for the fact that if you take it up here, you're going to get a wrong reading and it's going to hurt me like heck.
Yeah.
Like,
and you know that. Like you're living in your body, right?
Yeah.
And I say that about the advocacy, but it's really hard, right? Like I want to recognize that like saying you have to advocate for yourself is like easier said than done, right? Like it's a hard thing. But
it's very hard.
Yeah.
So before we wrap up, is there any, I always like to end with like tips and tricks. Is there any like tips and tricks that you would suggest for someone who's struggling with the health field? Yeah. Anything?
Oh gosh. And I feel like this is something that I'm still like really working at, like, and it's hard, right? So, there is like have you guys heard about like HAES?
Yes.
Health at Every Size framework.
No.
Okay. Yeah, something to look. And it's basically like a weight centric or a weight neutral kind of model to health. And they have like HAES, it's like HAES. HAES health sheets.
Yeah.
I think if you just Google that, and they go with different conditions, and they just they have some scripts for people if you wanted to bring that to your doctor about like say what you want or just ways to advocate for yourself. And I think also like fat community, like, and I really appreciate you guys having this platform, like just for people to be able to like listen to other people's stories and connect on something that's so that you don't see everywhere, right? So I think making those connections, whether it's like this podcast, other podcasts, following who you follow online, like I've really curated my like Instagram and like all my social media to be like fat positive creators or people that are and some people that talk about weight and health and the other stuff, like in terms of like thinness and like those thin model, like I get that everywhere else, literally, right?
Everywhere.
So it's like if I'm curating my social media and that can be a place that I'm exposed to these things that I wouldn't otherwise be. So I would say just looking at who you're following, who you're engaging with, the things that you're seeking out, just to kind of hear other people and find community. But it's hard. It's not
Health at Every Size is good. I used that resource a lot when I was doing that project for the disability management.
That's awesome.
You would love it, Tammy.
Yeah, you should totally. Yeah.
I would say like the advocacy of you to bring a support person. Like I know Tammy's done that a few times.
Yeah.
That might be helpful as well.
Sure.
Like if you're really struggling. Yeah, that would be my advice.
I've also advice from like lipedema.org is a great place, and they have resource sheets that you can take to your doctor or whatever medical profession that you're seeing, and you just basically give it to them and say, this is the condition that I have, here's some information just in case you're not familiar with it,
right?
You know, and you don't have to be aggressive with it, but you can maybe plant a seed, right? That this is a legitimate disorder,
right? Yeah, because you can also freeze up in those appointments, right? Like go in with something you want to say, and you get there and you're like,
because we have that like doctor is God thing, right? Like,
and it feels scary to challenge them.
What did someone always say to me? I can't remember who, but they put their pants on one leg at a time, just like everyone else.
Right.
It's true.
Yeah, totally. Yeah.
All right. Well, is there anything else? Anybody else? No. Anything else? Okay.
Thanks you guys for having me and for like
having
this platform and this community.
I learned a lot.
Yeah, I learned from you guys too. So thanks so much.
All right. Thank you.
Hiding, no more feeling small. We're taking up space, standing proud and tall. Our voice is strong, our stories to be heard, challenging the stereotypes.